There are three basic groups of drugs, and each one affects the body in a unique way. Depressants, like cannabis or marijuana or hashish, as well as GHB, also known as fantasy, and alcohol, slow down electrical signals between your brain and your body. Then there are stimulants, such as cocaine, ecstasy, amphetamines and methamphetamines or ice. These work differently by speeding up the messages to your brain. And then there are hallucinogens, or psychedelics, which include drugs like LSD and magic mushrooms. These alter a person's perception of reality, making them see and hear things that aren't there. Ecstasy is classified as both a hallucinogen and a stimulant. Cannabis can have a similar effect in large enough quantities. There are many different names for the same drugs, and they are frequently changing. For example, cannabis comes in various forms, strengths and strains, and goes by different names, including marijuana and hashish. Cannabis also has many street names, including pot, dope, grass, Mary Jane, weed, head, doobie, and ganja. In the same way, amphetamines go by various names such as speed, uppers, Louis or whiz, for example. Ice is sometimes called crystal meth or just plain crystal, and sometimes shabu, glass or shard. Cannabis is the most used illicit drug among young people, with over 14% between the ages of 12 and 17 having tried it. In the same age group, stimulants like cocaine, amphetamines and ice are generally used less. There are similar results with hallucinogens at 3% and ecstasy at 2.7%.
Hi, this is our group presentation and we will be discussing our topic about chronic stimulants and cause of neurocognitive disorder in later lives.
3, 2, 1.
The background of the study. So the purpose of this study is to determine the possible cause of neurocognitive disorders that mostly affects adults. So older adults are much more prone to suffer despite that it can happen or impact people of all ages. So people who regularly consume certain stimulants can have severe memory impairments and problems such as psychosis, hypervigilance, anxiety, and depression. Also, stimulants comes in many different shapes and sizes with varying degrees of legality and usage.
Stimulant drugs come in many different shapes and sizes, with varying degrees of legality and usage. Stimulant drugs are classified into numerous classes such as amphetamine, cocaine, caffeine, and etc. The use of prescription stimulants or illegal stimulant drugs on a regular class raise the risk of developing a substance use disorder, such as chemical dependency or addiction. Long-term stimulants use may also result in long-term psychiatric problems. Treatment is available for you, regardless of how severe the consequence stimulants you are.
Good morning everyone, I am Jessica Biganat, and now let's talk about the objectives of these studies. There are so many objectives on these studies, and one of the objectives is to discuss how chronic stimulant use of illegal drugs such as cocaine and amphetamine may lead to hallucinations, aggressions, and paranoia in a person. And with the daily use or a long-term use of these illegal drugs may also lead to major neurocognitive disorder or behavioral problems in a person. And also one of the important objectives of these studies is to understand how the present medications such as risperidone can help people or patient with his psychotic problem. For those who didn't know, risperidone is a depressant drug that slows down the central nervous system, which helps the person or a patient to calm down and relax. It is also used to treat people or patient who has a mental disorder such as schizophrenia, being overly aggressive, bipolar disorder, or irritability associated with autistic disorder. Another thing is to understand that chronic daily stimulant use of these illegal drugs can also lead to the onset of other diseases such as stroke, hypertension, Alzheimer's disease, Parkinson's disease, or Lewy body's disease, and other diseases.
The main objective of this study is to help or treat people who suffer from depression, people who have mental illness due to illegal drugs that leads to unpleasant actions or behaviors, people who are naturally born with mental problems such as schizophrenia and bipolar disorder, and people who have brain damage. All of these may have a negative impact on their lives. The goal of this study is to educate people about the potential effects of illegal drug use on human mental health, as well as to share effective treatments for people with mental illnesses, such as the right drugs that can be prescribed by specialists, or right method such as functional magnetic resonance imaging or fMRI. To discuss how chronic stimulant use of illegal drugs such as cocaine, amphetamine may lead to hallucinations, aggression, and paranoia, stroke, dementia, Alzheimer's, Parkinson's, or Lewy body's disease. With daily or long-term use, it may lead to major neurocognitive disorder and behavioral problems in a person, and also to understand how a depressant medication such as risperidone can help the patient's psychotic problem. Risperidone is a depressant drug that slows down the nervous system, which helps the patient calm down and relax. It is used to treat patients who experience mental disorders such as schizophrenia, being overly aggressive, bipolar disorder, or the irritability associated with autistic disorder.
The women went through different processes and methods of treatment. The patient underwent physical and neurological examination, but the result of these two tests on the patient did not show any abnormalities. He also underwent a hematological and biochemical test, which is complete blood counts, electrolytes, vitamins, glucose, thyroid, kidney, and liver were examined or tested, and the result is this test for the patient were completely normal and has negative result for screening for cocaine. Amphetamine and tetrahydrocannabinol, another method for treatment that was done to the patient, was to take the risperidone 4 mg once daily. Risperidone is the prescribed drug that is given to the patient to become when they are suffering an hallucination and aggression.
The patient also undergoes Wechsler Adult Intelligence Scale. This method of treatment is an IQ test designed to measure intelligence and cognitive ability in adults and older adolescents. In this test, the patient was given the clock drawing, trail making, 15-word memory, fluency, stoop and purchase maze test, but the patient did not get a perfect score in this test. Out of 30, only 22 was obtained by the patient. Therefore, the neuropsychological test performed on the patient showed a deficit in memory, attention, executive functions, information processing speed, and visuospatial ability. Due to the low results of this test, another assessment was conducted to investigate the underlying etiology of the established cognitive impairment. The patient underwent cerebral magnetic resonance imaging. This is a painless procedure that uses a magnet that produces clear images of the structures inside of the head or the structures of the brain of the patient.
A number of etiological categories such as infections and Parkinson or Lewy body disease could be ruled out based on the clinical presentation and the additional diagnostic testing when the patient was admitted to an adult psychiatric unit. Alzheimer's disease was ruled out due to the early onset of cognitive decline, lack of a family history of dementia, and the absence of hippocampal and cortical atrophy. Consideration was given to either a vascular or frontal temporal neurocognitive problem, the latter because of the patient's persistent and disinhibited behavior. Neuropsychological testing, as opposed to focusing only on frontotemporal aspects, revealed more widespread cognitive impairment. Additionally, MRI revealed no involvement of the frontal temporal lobes. The white matter lesions shown by the brain MRI are most likely to blame for the cognitive dysfunction. These lesions are the most likely the outcome of microvascular illness due to the effects of cocaine and amphetamine on cerebral blood flow, as no major vessel disease was seen by the ultrasound scan. Stroke and toxic leukocytes, allopathy are potential causes of white matter abnormalities and cognitive impairment in substance use. However, significant neurological symptoms are most frequently present in conjunction with both illnesses. As a result, we came to the conclusion that these diagnoses were implausible because our patient did not exhibit any abnormal neurological symptoms. Furthermore, the stroke damage seen in our patient is less localized than the damage seen by the MRI scan. But emergence of more confluent pattern of white matter signal hyperintensities without neurological symptoms has also been linked to cocaine usage. As a result, we came to the conclusion that the major neurocognitive disorder with behavioral issues, DSM-5 code 292.82, most likely had a vascular origin as a result of persistent stimulant usage. It's probable that this illness will become more common in the future given the increased prevalence of illicit stimulant use among older persons. This potential source of neurocognitive impairment needs more attention. Asking if persistent stimulant usage is important when older person arrive with cognitive impairment. In the event of substance abuse, we suggest referring the patient to a specialist for brain imaging and neuropsychological testing.
As a result, we came to the conclusion that these diagnoses were impossible because the patient did not exhibit any abnormal neurological symptoms. Furthermore, the stroke damage seen in the patient is less localized than the damage seen by an MRI scan. But the emergence of a more confluent pattern of white matter, signal hyperintensities without neurological symptoms has also been linked to cocaine usage. As a result, we came to the conclusion that the major neurocognitive disorder with behavioral issues, DSM-5 code 292.82, most likely had a vascular origin as a result of persistent stimulant usage. It's probable that this illness will become more common in the future given the increased prevalence of illicit stimulant among older persons. This potential source of neurocognitive impairment is need more attention. Asking if persistent stimulant usage is important when older persons arrive with cognitive impairment. In the event of substance abuse, we suggest referring the patient to a specialist for brain imaging and neuropsychological testing.